Scene: Dr. Carter's office. Mrs. Tran and her husband, Mr. Tran, sit anxiously as Dr. Carter reviews her test results. There's a tense silence before the doctor speaks. Receiving the diagnosis. Dr. Carter. Mr. and Mrs. Tran, thank you for coming in. I have your test results here and I want to go over them carefully with you. Mrs. Tran, nervously, is something wrong, doctor? Dr. Carter, sighs. The scans show that you have a condition called chronic obstructive pulmonary disease or COPD. This means your lungs are damaged, making it harder for you to breathe. Mr. Tran, frowning, COPD? What does that mean exactly? Dr. Carter, it's a progressive lung disease, which means it won't go away, but it can be managed. It's often caused by long-term exposure to irritants like smoking or air pollution. In your case, Mrs. Tran, your history of smoking has likely contributed to this condition. Mrs. Tran, looking down, I quit smoking years ago, but I guess the damage was already done. Dr. Carter, quitting was the best thing you could have done and it's helped slow the damage. But the symptoms, like shortness of breath, coughing, and fatigue, will get worse over time if we don't take action now. Discussing treatment options. Mr. Tran, worried, is there a cure? Can she get better? Dr. Carter, there's no cure, but with the right treatment we can control the symptoms and improve her quality of life. Right now, she's in the moderate stage, which means we need to start treatment immediately to prevent it from getting worse. Mrs. Tran, softly, what kind of treatment? Dr. Carter. We'll start with inhalers to help open your airways and make breathing easier. You'll also need pulmonary rehabilitation, which includes breathing exercises, light physical therapy, and lifestyle changes. Mr. Tran nods. And what about medication? Dr. Carter. There are bronchodilators which relax the muscles around your airways. And in some cases steroids to reduce inflammation. If your oxygen levels drop too low, you may need oxygen therapy in the future, but we'll monitor that closely. The emotional moment. Mrs. Tran, tearing up, I never thought it would come to this. I used to be so active. Now even walking up the stairs makes me feel exhausted. Mr. Tran, holding her hand, will do whatever it takes to help you. Dr. Carter, gently, Mrs. Tran, I know this is overwhelming, but you're not alone. The most important thing is to stay ahead of this. If you follow the treatment plan, avoid lung infections, and take care of yourself, you can still live a full and active life. Mrs. Tran, wiping her tears, one step at a time, right? Dr. Carter, exactly. We'll take this journey together. The scene fades as Mrs. Tran takes a deep breath, determined to fight for her health.